Hi, I'm Randall. I'm a student at IBW, and today I'll be doing my inferior limb palpation video. I'll do a quick survey of the room, just so you can see that there's no notes lying around. Sleepy cat right there. No notes besides, I do have this, which is my list of bony landmarks and muscles to palpate today. There's a clock back there. And let's get started. So the first bony landmark that I have is the ASIS. If you could just point to your belly button, please. There's the belly button, and right laterally is the bony landmark that I know is the ASIS, because it's on the anterior side of the body, superior. Like there's more ilium, but this is the superior aspect. So this bony landmark is the origin of the muscle that I'll talk about next, which is the tensor fascia latae, which originates at the ASIS and inserts into the iliotibial tract, which is something that goes like down to here, down the side of the leg. The actions of the tensor fascia latae are to abduct the hip, that's abduct, medially rotate the hip, and flex the hip as well. So those actions are, if you could just like lift your leg upwards, that's abduct, you're taking it away. So that's abduct. Medially rotate would be just kind of like rotate inwards, like towards your body. That's medially rotate. And flex the hip, and that's lift your knee towards the knee. Yeah, that should be flexion of the hip right there. Thank you so much. You can relax now. So there's that tensor fascia latae. The next muscle I want to talk about is the rectus femoris, which is just lateral to that muscle that I just was talking about. This rectus femoris muscle is going to flex the hip and extend the knee. It goes all the way to the knee. Okay? The knee has a bony, like you might know the kneecap, that is called the patella. That's a bony landmark I'm supposed to point out today. That also was where that rectus femoris inserts to. Then there is the head of the fibula. So, am I still in frame here? Let's see. This part of your leg, you have the tibia and the fibula. The head of the fibula is right here on this side. So, like, here's the femur, 2 centimeters away, the fibula. But then you go back up 2 centimeters back up, you got the medial condyle of the femur that I was just saying. So that's the medial condyle. So these two bony landmarks I just pointed out there. Now you have your tibialis anterior muscle, which goes from here to here. It goes to the first base of the first metatarsal, which is right here. So it inserts here and originates right here. And that muscle is responsible for dorsiflexion of the ankle. So if you could just put your ankle towards your head, thank you. It can do that. So that's what just did that right there. And it also tibialis anterior. That one, I believe it flexes the knee as well, since it does articulate with this patella right here. So you just did that action. Thank you so much. You can relax again. Now we have the medial malleolus. See, I'm definitely not in frame anymore. Medial malleolus, if I could just roll your well, right there. You can see that. Like, this is that bony medial though, so actually I'm on the wrong side. So the medial side is right here towards the midline of the body. But yeah, again, that bony, like that ankle bone, I want to call it, you know, as in layman's terms, that's called the medial malleolus. Now let's go to the, if you could just lay on your belly now, got two more muscles here. One of them is the biceps femoris. Gotta make sure I'm in the frame. Biceps femoris is going to, this is the ischial tuberosity, that bony landmark you sit on, that it originates there. It goes all the way to that, I did point it out earlier, and it is that head of the, or the medial condyle of the femur. There we go. Okay, I'm definitely not in frame. There we go. Medial condyle of the femur. So this biceps femoris is a not a tricep. What am I trying to say? Quadricep. No, opposite. Hamstring, sorry. That is in charge of flexing the knee. So now that you're prone, you can't flex the knee so much. Actually, you can just lift your knee up. That's flex the knee. There you go. Thank you. And it extends the hip. Wait, flexes the knee. It definitely flexes the knee. It also it articulates with the hip as well. I'm just trying to remember if it, I'm going to say extends the hip. Last muscle that I'm going to palpate tonight is the gluteus minimus, which is very deep to the gluteus maximus and the gluteus medius. But the actions today, it's going to abduct, that's abduct the hip, flex the hip as well as medially rotate the hip, which is bringing that hip towards your midline again. It originates at in between the gluteal lines, the posterior, or the posterior, the anterior gluteal lines, and it originates, I believe, in the sacrum area. So that is going to be my palpation video for today. I gave my best attempt at 10 different items to palpate, 5 of them being bony landmarks and 5 of them being muscles. So thank you for watching and have a great day.